The Fertility Society of Ghana is calling on frontline physicians not to trivialize or dismiss symptoms of persistent and severe abdominal pain often presented by female patients during their menstruation. Instead, they want and must probe further for an accurate diagnosis. At the second annual Congress of the Fertility Society, it was revealed that about 50% of women who have difficulty in conceiving are likely to be suffering from endometriosis. A report by Cyril Furi.
Endometriosis is an often painful disorder in which the tissue that normally lines the inside of the uterus instead grows outside of it. Endometriosis most commonly involves the ovaries, fallopian tubes, and the tissue lining the pelvis. Although rare, endometrial tissues may spread beyond the pelvic organs to the lungs, brains, and the eye, among others. The primary symptom of endometriosis is pelvic pain, often associated with excessive bleeding during the menstrual period. Pain during or after sex is also common with endometriosis. Some patients encounter pain with bowel movements or urination. Endometriosis is the cause of infertility, and patients may experience fatigue, diarrhea, bloating, or nausea, especially during the menstrual periods. In Ghana, about 10% of the female population is said to have endometriosis, often underdiagnosed and untreated because frontline workers are said not to have enough knowledge about the disorder. Reproductive health experts say endometriosis can be a challenging condition to manage due to its chronic nature. An early diagnosis, however, may result in better management. They concede that drugs available are not wholly effective.
Most people will give you a painkiller, and the painkiller works anyway. And then once the period is over, you're free of pain, but then you come back again. But if the doctor takes time to ask more questions, the duration of the pain, does the pain radiate to other parts of the body, what drugs are able to relieve you of the pain, they must start to suspect that there's a possibility of endometriosis.
Catherine Berko has survived the severe stage of endometriosis for the past 32 years.
I've had 3 laparoscopies and I've had 4 open surgeries. And so when people complain about little things, for me, I think they're stressing about nothing because I've had a bikini incision, but I don't have a baby to show for. I get bloated and I have people asking me, are you pregnant? Which is not fair. I'm not pregnant. I turned 43 this year, but I feel like an 80-year-old because of the treatment I'm having. It's helping me with the pain, but you get all these joint pains, nausea, dizzy spells. You can never tell what's going to happen next.
For lack of knowledge about the condition, some people misconstrue the pain women undergo and rather neglect them instead of giving them support. Those women suffer silently from societal ridicule. The second annual Congress of the Fertility Society of Ghana sought to assess the disease burden in Ghana and create more public awareness about endometriosis. Cyril Furi, GBC 24, Accra.